Hi everyone, I'm Dr. Emilie Solomons. I work at AcuBalance Wellness Center in Vancouver, Canada, and have been practicing for 14 years. I also became a doula 15 years ago. This video is for anyone in their last month of pregnancy. Please don't try any of the techniques in this video prior to 36 weeks gestation, as some of the points are used for labor promotion and birth preparation when stimulated strongly. If you are preparing for labor and are beyond 37 weeks, I also suggest you have a look at my acupressure for labor video, which shows some key combinations you and anyone supporting you during your labor might want to use. If you can, watch this video with the person you are going to be with during your labor or childbirth, whichever words you prefer, or at least have them watch it before practicing together. So you might ask, why bother with massage or acupressure to support labor preparation and during labor? There's actually good evidence for moderate pressure massage for its effectiveness in reducing pain and improving maternal outcomes during labor. For those interested in how it works, the moderate pressure stimulates the vagal afferent fibers under the skin, which stimulates the release of GABA and oxytocin through the vagal nerve connection. For the rest of us, where that didn't make any sense, what it means is moderate pressure massage is shown to stimulate the feel-good love hormones in our body, namely oxytocin. Oxytocin helps bond couples together and is essential for labor progress. So stimulating oxytocin and getting into a relaxed, safe, ideally dark, comfortable space has actually shown to improve how people manage and experience their childbirth. So really the question is, why not? I'm going to teach you a combination of massage and acupressure that you can start at 36 weeks onwards to encourage those beneficial hormone responses for labor preparation and to encourage the baby to get into an optimal position. Because I am at home practicing social distancing, my lovely 7-year-old will be my pregnant person for today. So let's get started. All right, so the first point I'm going to be doing today is actually at the top of the shoulders. So what we're going to do, I'll have you face this way, is you're going to start up near the neck and you're going to be easing your way downwards, all the way to kind of the end of the shoulders, over those muscles. Now this is a really, really lovely one. I have to say it's probably everybody's favorite because we tend to keep a lot of our tension all up here in the shoulders. What you're trying to do is you're actually going over a specific acupressure point, which is called gallbladder 21. Had to take a minute there. The location of gallbladder 21 is if you put your head down, you're going to feel a nice little bump on the spine here. If you take that point with the end of the shoulder and you draw an invisible line, the halfway mark is gallbladder 21. So when we're doing our moderate pressure massage, you're actually going over that point. And what that point does is it actually causes a downward movement, which helps the baby nestle further into the pelvis. The next point we're going to do, so I'll actually come around and then do the leaning over. There we go. All right, I'm going to move the camera down a bit more so you get a nice good look. Now, of course, your hips are larger than my child's hips, but for the sake of this, you'll get a general sense of what to do. The next point we're actually going to be going over is bladder 32. So the massage technique goes over the sacrum. The sacrum is a triangular bone at the base of our spine. So what we're going to be looking at is about up to the knuckle, that length above the bum crease. The key here is that you're not using your finger, you're using the finger of the person that you're actually doing the massage on. So love if you give me your hand. I'm just going to measure my finger up against my child's, and as you can see, there's a big difference. So if I measure about to there on my child's finger, just above the bum crease, and on either side, about a thumb's width on either side of the spine, you're going to feel these little divots. What we're doing is we're doing an outward motion and we're feeling around for any kind of knots or tightness that might be going around here all along the buttocks. Often what happens in the last month of pregnancy is that as our belly gets bigger, we tend to grip our buttocks and our hips in order to compensate for the weight that's moving forward because of the stomach, or the uterus really. So doing this massage is actually going to release a lot of that tension, which allows more space for the baby to, again, nestle in further into the pelvis. This is our ideal goal. Now, the next one I'm going to have you do, so if you want to spin around and sit up on here, perfect, is, and we're going to get your foot bent up like this. Our next one, maybe we'll get you to tilt a bit this way. There we go, like that's perfect. So the next one we're going to do is we're going to take the inside of the ankle bone, and what you're doing is just going posterior. So that is behind the tibia, so towards the Achilles. And you're going to be doing gentle circular motions. So what you're doing is you're doing like a gentle circular motion up, all the way up until you hit the belly of the calf muscle. So now this point, unlike the one up on the shoulder, doesn't feel as good. It feels almost a bit bruisey, but the important part about this is you're going over a point named spleen 6 that is essential and wonderful for cervical ripening and preparing the cervix. And so of all of the points, I find this one of the best ones for the cervix. So you want to, even if it doesn't feel great, it should not hurt, but it might feel a bit bruised and uncomfortable. So just make sure you're talking together so that it's still at a comfortable place. And then finally, the last point that I actually use often for any time there's someone who has stress or anxiety is a massage on the base of the foot at a point called kidney 1. Now I feel like everybody has some stress and anxiety right now. So I'm going to start off by, got a nice foot here, which is perfect. The point, and dry. The first point that you're going to use your thumb is actually just at the base of the ball of the foot here. So if you imagine the foot without toes and you cut it into thirds, you're actually going to find the point, which is right at the base of the ball of the foot, and you're going to put your thumb there. Then you're going to have them point their toe, and you're going to rub between the first and the second toes. You're just going to go from the web all the way up to where the bones meet. So you're putting your thumb underneath the ball of the foot here, and then you're putting your finger and you're massaging between the two, first and second toe, all the way up to where those bones join. And what this point does is it really helps calm and draw energy downwards. And a lot of times when we're feeling anxious and stressed, all of the energy is up here. And so by massaging these 2 points, you can actually help really calm the person. In labor, it's really key that our bodies are in that safe, calm space so that things can produce more or progress more smoothly. A lot of times, bright lights, feeling stressed, having people interrupt us or watch us can get us into what's called a fight or flight sympathetic response. And that can be counterproductive to the progress. If you imagine animals like cats, what do they do when they go have a baby? They're not doing it right in the living room. No, they'll hide under the stairs, or they'll go in a dark, safe space to have their babies. So what we want to do is anything we can to help create that dark, safe space. And as the person who's going to be supporting you doing the massage, help the body get into that place where it feels like, okay, I am safe, I am calm. This is a great time to have a baby. So what you're doing ahead of time as we're preparing for the birth is you're creating that connection, you are communicating together so that once it is actually time, your body recognizes the second your partner, whether it's your doula or your friend or parent or anyone, touches your body, oxytocin is released, the connection is automatically turned on, and the body goes, oh, I'm safe, and this is a great time to have a baby. And when you do that, the body opens up way quicker, way easier. You have a much better and connected birth experience. So for those of you who are going to start trying and you're at least 36 weeks, I would massage each area for about 5 minutes. Like the ones up here, you may want a little bit longer because it feels great, but we're kind of looking at each area for about 5 minutes. At 36 to 37 weeks, you can do this massage once or twice a week. From 38 weeks to 40 weeks, you can massage every day. And from 40 weeks onwards, you can go to 10 as much as you want. And don't forget to watch the acupressure for labor video to see more specific instructions and combinations to do during labor itself. All right, everybody. From my family to your growing one, I just want to say I hope you have a wonderful birth, and we'll talk to you soon.